Hey Anto, it's so good to see you. What are you up to?
Hey Claudia, I'm booking my next vacation to Mexico right now.
So nice. I hear it's a pretty heated city. Are you taking any sunscreen?
No, not really. I don't think it's that important.
Anto, there is a lot of medical evidence that proves that UV rays from the sun increases your chances of getting skin cancer.
I actually wasn't aware of that. Since we're at the library, do you mind helping me do some research about skin cancer so I can be prepared for my trip?
Sure, let's do it. In order to talk about skin cancer, we must understand the definition and the structure of the skin. The skin is the body's largest organ. It protects the body against infection and injury and helps regulate body temperature. The skin also stores water and fat and produces vitamin D. The skin is made up of three main layers: the epidermis, which is the outer layer of the skin, the dermis, which is the inner layer of the skin, and the hypodermis, which is a deep layer of fat.
Skin cancer has been characterized as the uncontrolled growth of cells in the skin. There are two distinct types of skin cancer. One is melanoma and the other is non-melanoma. Now you may be asking, what's the difference of melanoma as to non-melanoma? Non-melanoma skin cancer is referring to any cancer that forms in the basal, squamous, or Merkel cells of the skin. On the other hand, melanoma is a skin cancer that develops in the skin's melanocytes. Basal cell carcinoma is the most common type of cancer. Estimatedly over 4 million cases are diagnosed annually in the US. Up next, we have the squamous cell carcinoma. This sort of carcinoma may also be developed in parts of the body which are not exposed to the Merkel cell carcinoma is a very rare and aggressive form of skin cancer, with a very high risk of returning within 2 to 3 years from the initial diagnosis. As Claudia had mentioned earlier, it is true. Skin cancer non-melanoma is caused by damage of DNA resulting from exposure of UV radiation from the sun. This type of cancer is even more deadly than melanoma, but if detected early, it can be treated successfully. Over 9,500 people are diagnosed with skin cancer daily, and more than 2 people die from the disease every hour. It's estimated that the number of new melanoma cases diagnosed in 2020 will increase by almost 2%. The Merkel cells are located deep in the top layer of the skin. Often, the Merkel cells appear on sun-exposed areas of the body, sometimes looking like a pimple or a lump, or a skin-colored red, purplish, pink. It's statistically proven that 1 in 5 Americans will develop skin cancer by the age of 70. As you can see from the chart attached of a 2017 statistic of new cancer ratings, from male to female, females have 18 cases per 100,000 people, and male have 29 cases per 100,000 people.
Each type of skin cancer can appear differently, so it's important to talk with your doctor when you notice a change in your skin. Changes in the skin are the main warning sign for skin cancer. For basal cell carcinoma, 2 or more of the following features may be present: an open sore that bleeds, oozes, and remains open for several weeks, a reddish, raised patch or irritated area that may crust or itch but rarely hurts, a shiny pink, red, curly white, or translucent bump, a pink growth with an elevated border and crusted central indentation. Squamous cell carcinoma can often crust, bleed, and appear as a wart-like growth, a persistent scaly red patch, with irregular borders that may bleed easily, an open sore that persists for weeks, and a raised growth with a rough surface and a central depression. Merkel cell cancer often occurs as a painless, firm, shiny lumps on the skin that can be red, pink, or blue. For most types of cancer, a biopsy, which is the removal of a small amount of tissue for examination under a microscope, is the only sure way for a doctor to know if an area of the body has cancer. Your doctor may consider these factors when choosing a diagnostic test. Doctors use diagnostic tests to find out the cancer stage, so staging may not be complete until all the tests are finished. Knowing the stage helps the doctor to decide what kind of treatment is best and can help predict a patient's prognosis, which is the chance of recovery. Basal cell and squamous cell carcinoma usually do not spread to other parts of the body. On rare occasions, a person's lymph node may be removed to find out if the cancer has spread, which is called metastasis. Lymph nodes are bean-shaped organs that help fight infection. The doctor may recommend other tests to determine the extent of the disease, including blood tests, chest X-rays, and imaging scans of the lymph nodes and nerves, liver, bones, and brain, but this is uncommon. Doctors use the TNM system to describe the stage of Merkel cell cancer. Doctors use the results from diagnostic tests and scans to answer this question. There are 5 stages, stages 0 and stages 1 through 4. The stage provides a common way of describing the cancer so doctors can work together to plan a best treatment. Stage 0. This is called carcinoma in situ. Cancer cells are found only in the top layers of the skin. Stage 1. The primary tumor is 2 cm or smaller at its widest part. Stage 2A. The tumor is larger than 2 cm and has not spread to the lymph nodes or other parts of the body. Stage 2B. The tumor has grown into nearby tissues such as muscles, cartilage, or bone. Stage 3. The cancer has spread to the lymph nodes. Stage 3A. The tumor is any size or may have grown into nearby tissues. Stage 3B. The tumor is any size or may have grown into nearby tissues. This cancer has spread through the lymphatic system. Stage 4. The tumor has spread to distant parts of the body such as the liver, lung, bone, or brain. Doctors are working to learn more about non-melanoma skin cancer, keratinocyte carcinoma, and Merkel cell cancer, ways to prevent it, how to best treat it, and how to provide the best care to people diagnosed with these diseases. The following area of research may include new options for patients through clinical trials. Egfr inhibitors for advanced or metastatic squamous cell carcinoma. A tumor protein known as the epidermal growth factor receptor causes many squamous cell carcinoma to go out of control. Several clinical trials are investigating whether combining radiation therapy with drugs that inhibit EGFR can help treat advanced or metastatic disease. Immunotherapy medications are actively being studied for certain non-melanoma skin cancers, including Merkel cell cancer. These medications are usually given through a vein, and their effects can last a long time. Merkel cell polyomavirus is present in most but not all Merkel cell cancer tumors. Research continues to investigate the link between this common virus and this uncommon type of tumor, including whether the presence or absence of the virus in a tumor could result in different treatment approaches. Well, Anto, I hope you now recognize the importance of taking care of your skin in order to prevent skin cancer.
Yes, Claudia, thanks. I have learned a lot today and have now a better understanding of why I should take precautions with the sun. I could now go on my vacation more well prepared.